Hey everybody, my name's Shay Colvin. I'm a nursing student at Snead State Community College, and I want to talk to you about lung cancer. So the first thing that we need to know is what actually is lung cancer. And lung cancer is a cancer that starts in the lungs, but cancer itself is when cells in your body mutate and change, and those mutated cells grow out of control, and then they form a little cluster that's called a tumor. And these uncontrolled mutated cells keep spreading and growing, and they actually stop healthy cells from growing in your body. So when it's lung cancer, these mutated cells take over your lung cells, and eventually you have no healthy lung cells left. This picture here is an example of what a healthy lung looks like, and then what a lung that is infected with cancer looks like. So you can see the difference between the two. The healthy lung on the left is nice and pink, and it has really smooth outer appearance. And then the cancerous lung on the right looks very almost charred, and it is very rough. And actually, you can't see it in this picture, but the lung that is infected with the cancer actually doesn't expand like a healthy lung would, because of all the dead, dying lung cells there. And so it doesn't have the elasticity that a healthy lung has to allow you to breathe deeply.
Hello, my name is Mikayla Abbott, and I'm a nursing student at Snead State Community College. Today, I will be talking to you about the signs and symptoms associated with lung cancer. Symptoms of lung cancer are often nonspecific and appear late in the disease, so it is very important to contact your healthcare provider when you do notice a change in how you feel, no matter how small or how big the change is. Listed below are the most common symptoms seen with lung cancer. On this slide, I will go into further detail about pulmonary signs and symptoms of lung cancer. The word pulmonary just means relating to the lungs. Sputum, which is a fancier way of saying mucus that we cough up, is an indication that something may be affecting your lungs. Make note of changes in sputum, such as quantity and characteristics of it, especially if you notice that it is blood-tinged. This is usually associated with a persistent cough that no matter what over-the-counter medication you take, or maybe even antibiotic that is prescribed to you, you see no difference in the cough, and if you do see a difference, it only lasts a short while. Shortness of breath and wheezing. These symptoms can occur at times of exertion or during rest periods. Some questions to ask yourself are there positions that make wheezing better or worse? Was it easier to get around a month ago or even a year ago? Does the shortness of breath interfere with everyday life, such as work, family responsibilities, and leisure time? If you said yes to any of the questions above, please contact your healthcare provider. Recurrent pneumonia or bronchitis. Pneumonia is an infection that inflames your lungs and may cause your lungs to fill with pus and fluid. Pneumonia is life-threatening if not treated. Please seek medical help if you believe you have pneumonia. Bronchitis is an inflammation in the lining of the bronchial tubes, which carry air to and from your lungs. This may also cause you to have a persistent cough with sputum. Hoarseness. You can experience hoarseness with or without a cough. Pay attention to when you have hoarseness, such as how often or to what degree. Non-pulmonary signs and symptoms of lung cancer. Chest pain or tightness occurs when something is obstructing the airways or when something is not allowing the lungs to expand to their full potential. If you notice you're taking rapid shallow breaths to avoid pain, please seek medical attention. Shoulder, arm, or chest wall pain. Chest wall pain that extends to the arm and shoulder is a concern because it may be an indication that a tumor is spreading. When chest wall pain is present, it may indicate that a tumor or fluid is taking place where healthy tissue usually resides. Unexplained weight loss. Unexplained weight loss is a concern if you haven't changed your lifestyle in any sense, such as you still work the same job, eat the same food, and do the same amount of activity you always have, but you keep losing weight. Severe fatigue. As we grow older, it is common to feel tired because we have more responsibilities and our bodies are aging and requiring more energy. But if you notice that you cannot do the same activities you always do without feeling exhausted, and family activities feel daunting because you know it will be hard to participate, know that this isn't normal and needs to be addressed. Swollen lymph nodes. Swollen lymph nodes are an immune response that usually tell us that our bodies have a bacterial or viral infection and it is trying to fight them off. But when multiple lymph nodes suddenly start swelling and you have no other symptoms, your best course of action is to schedule an appointment with your healthcare provider.
Hey y'all, my name is Becca Braden and I'm a nursing student at Snead State Community College. Today I'm going to be telling you about some of the recommended treatments that's used for lung cancer. The first type of treatment that I'm going to tell you about is chemotherapy. Now this is often the treatment of choice for lung cancers, especially small cell lung cancer. This can be used alone or in combination with surgery or some other type of treatment, especially for non-small cell lung cancer. Some side effects that you may incur would be nausea and vomiting, hair loss, mouth sores, anemia, and or peripheral neuropathy. Then we have radiation therapy. This can be a very effective treatment for locally advanced lung cancers that's confined in your chest. Best results are seen when radiation is used in addition to surgery or chemotherapy. Radiation may be performed before surgery to shrink the tumor. Some side effects would be skin irritation and peeling, fatigue, nausea, and taste changes. You may need to see a dietitian for consulting with the best types of food that you need to be ingesting during your treatment, such as soft, bland, and high in calories. It is also recommended to do a liquid nutrition supplement, such as an Ensure or something like that, in between meals to help maintain weight and energy levels. And also, during radiation, it is recommended for patients to avoid direct sunlight exposure to the skin during treatment for at least 1 year after radiation is completed. The next type of therapy we will speak about is going to be our photodynamic therapy, also known as PDT. Now this is going to be used to remove small bronchial tumors when they are accessible by bronchoscopy. This is going to be performed in an operating room and the patient will be under anesthesia and they will be intubated. This is where a laser light is going to be used and be focused on removing the tumor. Some of your side effects is going to be swelling at or near the area of skin that's treated. You're going to have discoloration of skin, such as bruising. You will might have scales, crusts, or blisters on the skin receiving the treatment. There could be itching, stinging, or burning. And you could also have skin infections. Now the next type that we're going to speak about is going to be targeted therapy. Now targeted therapy is a common treatment for non-small cell lung cancer. Now this is going to be used in combination with chemotherapy usually. And targeted therapy increases the survival time for patients with non-small cell lung cancer, but it is not a cure. Some of your most common side effects for this is going to be diarrhea and liver problems. Some of the other side effects you may encounter is going to be problems with blood clotting and wound healing. You may have high blood pressure, fatigue, mouth sores, nail changes, loss of hair color, and skin problems. And some of your skin problems may be rashes and dry skin. The last type of treatment that I'm going to tell you about is going to be surgery. Now, surgery is the main treatment for stage 1 and 2 non-small cell lung cancer. This could be a total tumor removal, which would result in a cure, or it may be a partial. The specific surgery depends on the stage of cancer and the patient's overall health. Now, just remember, anytime that you have any of these treatments, it's going to be in consulting with your doctor, and you and your doctor will decide on what's best for you.
Hello, my name is John Eddings, and I'm a nursing student at Snead State Community College. Today I'd like to talk to you about some prevention measures that you can take to decrease your risk of getting lung cancer. Stop smoking now. It's not too late. Here are some tips to help you. Sign up for a behavioral support program. Use healthy snacks to help you with your cravings. Think about how much money you will save. Focus on your reasons why you want to quit smoking. Stay positive by taking it day by day. Take a deep breath for 5 seconds and think about your lungs filling up with clean oxygen. Change your routine to help you avoid cravings and triggers. And last but not least, slipping up doesn't mean you failed. Statistics show that it can take some smokers multiple times to quit successfully. But what about e-cigs? Aren't they healthier? Turns out they aren't. In addition to high levels of nicotine, e-cigarette liquids also contain propylene glycol and glycerin, which can irritate the eyes and airways. When heated and vaporized, these ingredients degrade into formaldehyde, which is a carcinogenic. Many of these devices produce a vapor containing chromium, which is a cancer-causing agent. Did you know that secondhand smoke has more than 4,000 chemicals? Many are toxic and cause cancer. You breathe in these chemicals when you're around someone who is smoking. The home is the primary source of secondhand smoke exposure for children. About 80 million, or 1 in 4, Americans live in multi-unit housing and can be exposed to unwanted secondhand smoke in their homes. Secondhand smoke from units or common areas where smoking occurs can seep into smoke-free units. Many who live in public housing are especially affected by secondhand smoke, including children, the elderly, and people with disabilities. Radon is a radioactive gas formed by the natural decay of uranium in soil and rock. It can seep into buildings through foundation cracks and other openings. Without proper ventilation, radon concentrations in indoor air can reach dangerous levels. You can't see it, smell it, or taste it, so it's easy to ignore. But radon exposure is a leading cause of lung cancer among non-smokers. A person exposed to high levels of radon has a 1 in 20 lifetime chance of developing lung cancer. Smokers face increased risk, with a 1 in 3 lifetime chance of developing lung cancer if they're also exposed to high radon levels. You can purchase a test kit at most hardware stores. Lung cancer rates, specifically mesothelioma, in construction workers who handle asbestos have been found to be 10 times higher than normal. Certain occupations carry an increased cancer risk. These include painters, furniture makers, workers in the iron, steel, coal, and rubber industries, and workers involved in shoe manufacturing and repair also. Always use proper protective equipment when handling chemicals and clean spills immediately. At your workplace, ask about material safety data sheets, which contain information about hazardous substances.
Hi, my name is Rachel Cooper. I'm a nursing student at Snead State Community College, and I would like to present some information about preventative measures for lung cancer. The 2 points that I'd like to bring up today are lung cancer screenings and the importance of quitting smoking. Should you be screened for lung cancer? Are you 50 to 80 years old and currently smoke? Have you smoked at least one pack a day for 20 years? Or have you quit smoking within the past 15 years? If you answered yes to any of the above, you should consider a screening for lung cancer. Next, what should you do if you decide to be screened for lung cancer? You would first need to speak with your healthcare provider. That way you could discuss the risk versus benefits of being screened. If you decide to be screened for lung cancer, you'd receive a low-dose CT scan at a facility that specializes in lung cancer screenings. You will then be scanned once a year to ensure no cancer appears. You may ask yourself, why should you be screened for lung cancer? Early detection is key. When you detect lung cancer at a very early stage, it's more likely to be cured. By the time the signs and symptoms develop, the cancer is usually too advanced for a curative treatment. The key to reducing your chances of developing lung cancer is to quit smoking. Smoking is the #1 cause of lung cancer. A few strategies that the Healthy People 2020 initiative discuss is to fully fund tobacco control programs, to implement hard-hitting anti-tobacco media campaigning, especially geared towards children, and also to expand treatment in clinical settings to help stop smoking.
Hey everyone, it's Shay again, and the next couple of slides that we're going to look at are health statistics for Marshall County, Alabama. And these health statistics that we have pulled actually directly link the risk or the ability of lung cancer patients to receive treatment. So the first statistic that we're going to look at is that 17.3% of the population in this county are over age 65. So couple that amount of the population who are over the age of 65 with those that are over the age of 65 that have been smokers their whole lives, and this is an astounding risk for lung cancer in that population. So as healthcare workers, we need to be proactive in ensuring that these patients know when they need to be screened and how often they need to be screened and what the risk factors are. The next statistic that we're going to look at, 14.4% of the under 65 population in Marshall County are not covered by health insurance. So what that means is that this population that is under 65 and still may be at risk because of a job that they've had or because they were smokers or they are smokers, they don't have access to health insurance, which means they will be much less likely to go to the doctor and get screened for lung cancer, or even when early symptoms develop, they don't go and get care or diagnostic tests ran because of the cost out of pocket. The next statistic that we're going to look at is smoking, and smoking is the leading cause of lung cancer. So in Marshall County, 23% of the population smoke, and that's actually 3% more than the Alabama average. So there are 3% more people in Marshall County that smoke than they do in the state of Alabama. So we definitely have an at-risk population here just in our smoking population. Also, 19% of Marshall County adults, so that's under 65 as well as over 65, are considered adults, and they are uninsured. So this would be a major financial burden on this entire population, and 19% is higher than the 14.4 that we talked about previously, especially in a chronic illness case such as lung cancer, as well as the patient to doctor ratio is 1,750 to 1. So even if these people are willing to pay out of pocket, it's hard to find a doctor around the Marshall County area for this disease process. The last thing we're going to talk about is air pollution, and Marshall County's rating is 10.7. So this air pollution directly affects the entire population's lung health, not to mention those that are already at risk or have unhealthy lungs due to the disease. This concludes our presentation. Thank you guys for learning with us today, and we hope you got a little bit out of it.